Hi, everyone. Welcome to Selling to Healthcare. I'm Lisa Miller. I've spent over 30 years in healthcare sales, from building lasting partnerships to driving real results for hospitals and health systems. And I'm here to share what I've learned about leading with service and how that can change the game for you no matter where you are in your career. So today I want to talk about something that I think is probably one of the biggest gaps I see in healthcare commercial teams right now. And it's something I feel really strongly about. And it's not product knowledge. It's not clinical evidence. It's not even, competitive differentiation, although of course all of those things matter. It's something I've been calling Fluent in healthcare. And what I mean by that is, do you really understand the way hospitals actually make decisions? Because, I think a lot of companies that sell into hospitals, they invest heavily, like really heavily in training their commercial teams. And look, those investments are important, right? Your sales professionals, they know the product science, they understand the clinical evidence, competitive differentiation, operational workflows, and they spend years developing like really deep expertise within specific service lines or therapeutic categories. Here's the thing. In the hospital market today, there's another capability that is becoming, I think, equally important and honestly, probably more important in a lot of ways. And that's fluency and how hospitals actually make decisions, like what's driving those decisions behind the scenes, right? So hospitals don't evaluate vendors based solely on product capability. I mean, they just don't, right? They evaluate solutions within the context of reimbursement, federal policy, margin pressure, and quality performance. And those forces, they shape how hospitals allocate capital, how they prioritize initiatives, and how they evaluate vendor partnerships. And when commercial teams understand that environment, their conversations with hospitals change in really meaningful ways. They begin discussions where hospital leaders actually make decisions. And that shift, that's really what I mean when I say fluent in healthcare. So I'm going to talk about what I think of as the CMS strategy gap, because I think this is where things get really interesting. Most healthcare commercial teams are highly capable, right? They understand their products, they know their customers, they work in one of the most complex markets in the economy, and they successfully navigate clinical, operational, and technical discussions every single day. So what's missing is not sales skill. And I want to be really clear about that. What's missing is structured fluency in how CMS strategy shapes hospital decision-making. And I think that's a really important distinction. And, hospitals operate within an economic environment that is heavily influenced by Medicare reimbursement and federal policy, like mandatory payment models, quality penalties, reimbursement forms, price transparency requirements. All of that influences hospital budgets and strategic priorities. And I think the truth is, most sales training was never designed to teach this layer of the healthcare market. It just wasn't built for that. So you end up with, even really experienced sales professionals who are very well prepared to explain how their solution works, but they're less prepared to connect that solution to the financial and policy forces that hospital executives are dealing with every day. And I think that's the disconnect, right? That's the gap. And that's the real opportunity, right? When your team develops CMS strategy fluency, they take the skills they already have and they elevate them. They're showing up differently in meetings, connecting what they sell to the financial reality of that hospital. They're having more strategic conversations with leadership, and they're standing out for reasons that go way beyond product features. So, okay, I want to walk you through something I think is really, really important, and it's how hospital executives actually evaluate vendors, because I think this is where the disconnect really happens. So most vendors begin conversations by explaining their product, right? That's where they start. But hospital executives, they begin somewhere else entirely. They start with financial impact. So in practical terms, hospital leaders tend to evaluate vendor solutions through a sequence, and it looks something like this. So first, it's financial impact. How does this affect hospital margin? Does it protect reimbursement? Will it reduce operating costs or avoid financial penalties? And if the financial impact is unclear, the conversation often just stops there. Like it doesn't go any further. Second comes alignment with reimbursement and policy programs. Hospital executives want to know how a solution fits within the payment models and the regulatory environment shaping their organization. Third is operational impact. Will clinicians adopt the solution? Will it improve workflow or reduce complications? And only after those filters are satisfied do most organizations even get to product specifications, technical details, and vendor comparisons. So, many vendors begin at the bottom of that stack. Hospital executives begin at the top. And fluency in healthcare means understanding that difference and structuring your conversations accordingly. So let's talk about the bigger forces that are shaping how hospitals think about strategy, because I think, if you're going to call yourself fluent in healthcare, you've got to understand the environment that's driving their decisions. Hospitals are not simply operating businesses, right? They function within highly structured economic systems shaped by federal reimbursement and regulatory policy. And CMS, so the Centers for Medicare and Medicaid Services, they play a central role in that system. CMS determines how hospitals get paid for Medicare patients, and it also determines how hospitals are penalized for poor quality performance or, excessive cost. And over the past decade, CMS has increasingly shifted the healthcare system toward value-based payment models. So instead of rewarding volume alone, these models hold hospitals accountable for cost, quality, and patient outcomes. And as these policies expand, they increasingly influence how hospital leaders evaluate investment. So understanding these policies, that's what allows commercial teams to connect their solutions to the strategic priorities that hospital executives are actually managing. So there are several major CMS initiatives right now that are, fundamentally reshaping how hospitals make decisions. And I want to walk you through the ones I think matter most. So the first one, and I think probably the most significant recent policy development, is the transforming episode accountability model, which is commonly called TEAM. And what TEAM does is it's a mandatory model launching in 2026 that puts hospitals on the hook financially for the total cost of care around certain surgical procedures. And this is huge. So participating hospitals are accountable not only for the surgical procedure itself, but also for costs incurred during the 30 days following discharge. And those costs, they can include readmissions, post-acute care, skilled nursing facility stays, and other services. So if hospitals manage these episodes efficiently and keep costs below CMS targets, they share in savings. But if costs exceed those targets, hospitals face financial penalties. And this model, it fundamentally changes how hospitals evaluate surgical technologies, care coordination tools, and post-acute management solutions. So products that reduce complications, shorten length of stay, or prevent readmissions, they become financially meaningful under TEAM in a way that, they maybe weren't before. And that's a really important shift. So the second one is the Hospital Readmissions Reduction Program, or HRRP. And this has been around for a while now, but it's still, really, really influential. So under HRRP, hospitals with higher than expected readmission rates for certain conditions can face penalties of up to 3% across all Medicare inpatient payments. And that's a significant penalty, right? So that penalty structure makes readmission reduction board level priority for many hospitals, and solutions that improve discharge planning, patient education, medication adherence, post-discharge monitoring. Those can directly influence performance under this program. And commercial teams that understand HRRP can position their offerings in ways that clearly connect to hospital financial performance. That's the key, right? So third is the hospital value-based purchasing program, often called VBP. So under this program, 2% of Medicare hospital reimbursement is withheld and then redistributed based on performance across several quality domains. And those domains include, clinical outcomes, patient safety, patient experience, and efficiency of care. Hospitals that perform well receive additional payments. Hospitals that perform poorly lose the withheld revenue. So, technologies that improve patient safety, infection prevention, clinical outcomes, or patient experience scores often align directly with these incentives. If you understand the structure of VBP, you can demonstrate how your solutions influence measurable hospital performance metrics. And that's, I think, a really powerful way to position what you're selling. And keep in mind, those are just three of the major ones. You've also got programs around hospital-acquired conditions and infection rates, site-neutral payment reform, a huge rural health initiative with, billions in federal funding, and stricter price transparency rules. And here's the thing, all of these programs are creating both financial pressure and opportunity for hospitals. And I think if you're selling into hospitals and you don't understand how they work, you're already behind. So now you might be thinking, okay, Lisa, why does all of this matter for me as a vendor, right? Why should my commercial team care about CMS programs? And the reason is pretty straightforward, right? Medicare is the largest payer in the U.S. healthcare system. So the policies that govern Medicare reimbursement, they directly shape how hospitals generate revenue and how they think about managing risk. And ultimately, how they evaluate every investment that comes across their desk. And hospital executives consider these factors constantly, right? CFOs are analyzing reimbursement implications. COOs are evaluating operational efficiency. Chief medical officers are focused on quality performance. And I think when you really understand these pressures, everything changes. You're no longer presenting a product. You're connecting your solution to what that hospital is actually trying to solve for financially and strategically. And that's what gets you in the room with executives. And so I want to talk about what it looks like to move from a product pitch to a strategic dialogue, because I think this is where it all comes together. In a lot of healthcare sales interactions, the conversation begins with product education, right? The vendor explains the technology, the hospital evaluates features and compares alternatives, and eventually the discussion just turns to price. But when commercial teams understand the policy and economic environment that hospitals operate within, the conversation often begins differently. It begins with the hospital's challenges, like how do we reduce readmissions? How do we manage episode costs under bundled payments? How do we improve quality scores? How do we maintain margin in a changing reimbursement environment? And when your solution clearly ties back to those questions, hospital leadership pays attention. You're not just explaining a product anymore. You're part of a strategic dialogue about how that hospital performs. And I think this really connects back to what I was talking about in the last episode, about insight, right? In competitive markets, information alone rarely differentiates vendors. Like every company can present product data and clinical evidence, but insight, that's what connects information to the problems that executives are actively trying to solve. And when a vendor demonstrates an understanding of the reimbursement environment shaping hospital decisions, it signals credibility, right? It shows that the company understands the customer's operating reality. And I think that's what opens the door to, real engagement with hospital leadership and real partnership. And at the end of the day, that's what you're trying to build. Okay, I want to kind of pull this all together, right? Because I think the big picture here is so important. Healthcare policy is going to continue evolving. Payment reform, value-based care models, quality measurement programs, they're all going to remain central to how hospitals operate. As these forces expand, the expectations placed on vendors are going to evolve right along with them. Hospital leaders want partners who actually understand the economic and regulatory world they're operating in. They respond to vendors who bring perspective and insight, not just products. And I think that distinction is only going to matter more going forward. And I think that's really what fluency in healthcare comes down to, right? Yes, product knowledge matters, but when you understand the system that's shaping how hospitals make decisions, that's when your knowledge actually becomes strategy. And I think, no one told me early in my career, like, it's really, really important that you understand all these regulations that hospitals have to face, all these reimbursement regulations, how reimbursement impacts the patient, how revenue cycle impacts a hospital. And salespeople have to understand this external environment. I mean, it's so important, right? Because when you really know it, you're putting the pieces together in every single meeting. And healthcare, so many connection points that you've got to be able to see. And so if you're able to see those patterns and connect them, you really can elevate yourself. And it takes, constant curiosity about what's going on in the healthcare field. It requires deep expertise in areas that you can't just skim, right? You've got to go deep. And it requires a real diversity of understanding across a field. So if you want to go deeper on this, I've built something called the Fluent in Healthcare Workshop. And it's a first of its kind strategic program designed specifically for commercial teams that sell into hospitals and health systems. And it teaches a capability that is rarely addressed in traditional sales training, right? Which is how to interpret CMS policy, reimbursement structures, and hospital financial strategy through a commercial lens. So participants learn how hospital executives actually evaluate investments, how federal payment initiatives and quality programs shape purchasing decisions, and how to position solutions within, the economic forces governing hospital performance. There's a link in the show notes if you'd like to learn more about that. And I really think it's something that can, change the way your team shows up in these conversations. And I've also put together some free resources that go deeper on all of this. So make sure you grab those as well. That's it for this episode of Selling to Healthcare. I'm Lisa Miller. I'll be back next week with more strategies to help you sell smarter and stand out. Until next time.